Good evening, everyone, and welcome. This is HealthyStart, and our presentation this evening is going to be an overview for parents. And it's my delight to be able to share and introduce this entire subject for you this evening, because when I was introduced to this entire philosophy, concept, and treatment, it was because I had a grandson that had a terrible need. He hadn't smiled openly in years. Probably the smallest kid in the class, and going through that awkward change and stage of life is no fun when you've got a train wreck in your mouth. And that's basically what he had. They call it a crossbite. The upper teeth behind the lower teeth and the canines kind of had, well, they were going in different directions. So when I heard that there was a program that could actually help straighten his teeth before he ever got to the stage where he would have gone into braces, I can't tell you how excited I was and how badly I wanted to get this information to my daughter, his mother. But you know, sometimes it's where you hear about something that can really paint the way you view it and receive it. So my say-so didn't go so far, but I got the right information in front of her, and before long, I had 2 grandchildren in 2 HealthyStart chairs. And we have a very, very happy ending. Well, we're getting closer to the ending, but the progress has been amazing. To watch all of this happen with your children so quickly over time without so much of the hassle that we so well avoided. So let me tell you that HealthyStart is a phenomenal company. First, I'm going to tell you a little bit about it, where it came from, who the inventor and the founder is, and why we have such an opportunity to be a part of something unique in our world. We're going to start out by telling you that 50 years ago, in fact, this summer, we're going to observe the 50-year anniversary, Dr. Earl Bergerson kind of started working in this area. He's a board-certified orthodontist, so DDS, MSD, ABO, and he started to work on these principles many years ago, and over time, not overnight, but over time, a lot of things started to be revealed. So he fine-tuned it. And over the course of decades, he now has over 500 patents, US and international, for his FDA-approved appliances. I think now the number of cases around the world is somewhere around 3.5 million children. Remarkable, irrefutable science. The data is very compelling. Dr. Bergerson also taught growth and development at Northwest University for the dental school there. He has 80 times been published in peer-reviewed journals, and he has 80 monographs. Again, this is an academic man who has committed his life to making children better, to make them the best versions of themselves, because they have the absolute best health when they are able to breathe through their nose. I know it sounds like, really? That's what we're talking about? Well, at the base of it all, that's what's really important. And the appliances that he has devised and designed, they are so highly engineered. They are advanced orthodontic and orthopedic appliances. As I said, they're FDA approved, but they also have no BPAs, no silicone, no latex. Cases are antimicrobial, and they meet the highest of standards. Of course, FDA, but also Health Canada certified and the equivalent of a Class 2 medical device. And if you're in the medical world, you know what that means, but basically it could be implanted inside the body like a pacemaker. So the absolute highest quality of materials for anything that you would put in your child's mouth. What you're going to put in your child's mouth is going to change them forever and in the best of ways. But better to tell that story than me is our speaker tonight. Our lecturer and speaker, one of our premier providers, is Dr. Jill Ombrello of Central Dentist up in the Dallas-Fort Worth area. She has a 4-generation pedigree in the world of dentistry. She was also a patient of HealthyStart because her father was an early adopter back in the 80s. I think she's going to tell you a little bit tonight about what that is like, because when you start a child off right, they have a good dental history throughout the entire life. Jill is also a speaker for the USDI, the United States Dental Institute, which means that she is up to speed on all orthodontics all over the country, and she was their first female speaker. So she's very highly accomplished. We love the work that she does. She's great at helping parents see the big picture, because once you connect the dots, well, I always say, once you know this, you can't unknow this. And Jill is also very key to the older population. In fact, their practice has a mobile unit that goes to people that might not otherwise get out and get the dental care that they need. So I am going to let Dr. Jill Ombrello, as you can see her in the pictures, she is working with patients and helping to train other doctors. In fact, the one just up on the top was just done in Jacksonville, Florida. That's Gerdine. Gerdine is a little girl who just had her tonsils, her adenoids, and her uvula in surgery about 3 months ago. So she's here to meet with us to find out how to maintain the advantages that she had through that surgery. And by the way, behind, that's Dr. Dolphy in the back corner. He's another one of our premier providers and speakers. I think that you'll be hearing from him if you tune into some of our parent overviews. Down in the lower left, well, that would be Ellie on the left and Franny to her right. Franny is Dr. Jill's daughter. Again, one of the many HealthyStart patients that she's likely to refer to in her webinar presentation tonight. But last and not least is in the upper left, that's the airway. Where's the tongue position? Are your children breathing with their mouth open or closed? These are key things. So perk up your ears, take out a pen, take down some questions, and know that if you have questions, you can go to that Q&A section on your screen. And the other people on the webinar will not see your questions. We will. And if they're generic in nature, I might bring them up at the end to ask Jill about it. Or if they're very personal, you can go ahead and let us know. We can arrange an email response or maybe even set up a phone call. But hang tight, because Dr. Jill is going to take it from here, and we'll come back at the end with information on how you can take it to the next level. So Dr. Jill Ombrello, take it away, Jill.
Research over the past 20 years has shown that those conditions we just went through can be attributed to sleep disordered breathing and sleep deprivation. So I'm going to start off here with this video. Here's a little boy sleeping. Now, hopefully all of your children are tucked in for the night, which will be great. Maybe some of you are still getting there. But what I'd like to do, well, we're going to watch about 15 seconds of this little boy sleeping. How cute is he, laying there with his little dog on his pillow? I want you to watch this child and maybe recognize some of the similarities that your child has when they sleep. And I want you to think to yourself, is this child getting a good night's sleep? Is this child receiving or getting restful, restorative sleep so that he can wake up in the morning and be the best version of himself? Let's watch this video. I'm going to play it for about 10 seconds, and then I'm going to cut kind of to the middle of the video. So hang with me here. All right, that's all I can handle. I can't watch this boy suffer anymore. I'll tell you, if you're anything like me, I have 3 little kiddos, and so most nights I put them in bed, I tuck them in, we talk about what we're going to dream about, say our prayers, and I sneak out the door. I hope that I don't see him until morning. I don't know if that makes me a bad mom, it's what I do. It wasn't until I really began understanding how important the quality of their sleep is that I then became the mom that would put them to sleep and then tiptoe like a crazy mom into their room quietly to really evaluate how they were sleeping. I found very quickly that yes, they're quiet and they're in their beds and I'm not seeing them until sometimes when the sun rises, sometimes before that. But the quality of their sleep is very scary. It's emotional for me to watch this little boy sleep. He's not getting a restful night's sleep. He literally is interfering, or his breathing is stopping, and he's having to gasp for air. We're going to talk about what that means. Now, I hope I don't lose the crowd here. I hope you guys don't went to your children's bedrooms to evaluate how they sleep. But I would encourage you that when we get off, when we finish our conversation tonight, for you to tiptoe into your child's room to evaluate how they're sleeping and see how they're doing. You might be surprised to see what you, to find out how they're sleeping. we have a conversation in our office with all the children that walk in. I told you 9 out of 10 children suffer from one of those symptoms. So we begin that conversation. We talk to parents. A lot of these children have these symptoms, and I'm asking them, what other options do you have? It's amazing the answers that I get. Everything from drugs, that's typically a common answer. Prescription drugs, counseling, play therapy, surgery to remove tonsils or adenoids, sleep studies, allergy testing, special education, tutoring, diet changes here in Dallas. That's a really big thing here, where a lot of children are gluten-free and dairy-free and sugar-free and eating healthier and still not getting necessarily the changes that they're looking for. We also have quite a few orthodontists here in Dallas who put young children in the rapid palatal expanders to open that top jaw, to open the airway. And I'm going to show some pictures of what that looks like. We have a huge population of patients here in Dallas, and I call them super moms. I mean, they are warrior mothers who are, and dads too, but they are looking for conservative, preventative measures to help their children. They want them, typically these parents aren't sleeping very well either, and so they want a better option for their children. And they're not happy with some of these options that they have. Especially, with those Dr. Googles that come in, parents, when you Google, it's crazy. There's so much information out there, but there's so much misinformation. So I'm going to give you a bunch of good information tonight. These conventional treatments, these prescription medications, what do they have in common? Well, here's the important thing to remember. They address the symptoms and not the root cause. So maybe they treat these outward signs and symptoms that you see with teeth grinding or snoring or ADD, ADHD, but they're not treating that real root cause that's making these symptoms manifest. They tend to be short-term Band-Aids. Research has shown that children do not get better over time with some of these symptoms. Most of these symptoms just get worse. And we're going to talk about that more here in a little bit. Often many of them involve several drugs with side effects. So it's great to take a prescription drug that treats this, but it now causes this and you have another issue. So that's not a great alternative for some patients. They can also be costly, painful, time-consuming, and ineffective. And that's been a real frustration as I sit across the table and talk to a mom where she's looking for solutions and she's not happy with what the other doctors are presenting. I like to educate these parents and say, hey guys, this is a medical problem. The quality of your child's sleep is a medical problem with a dental solution. And we're going to talk about that dental solution tonight. So how can dentistry help? Well, now it's way more than about cavities and straight teeth. We're not just looking to brush and straighten teeth. We're looking at the overall future health and well-being of every child. I think more than ever, and I'm I say a young mom. I'm probably not that young anymore, but I'm a mom. So I'm a mom with 3 young kids, and I'm looking at not only how are they doing in kindergarten and first grade, but I'm thinking about what can we do at this stage to help them have a lifetime of healthiness and happiness. So I find that I'm not alone in that most of the parents that I meet are looking for that same conservative approach to help their child have a lifetime of health. Aren't those 3 kids cute? I'm a little biased. Those are my 3 kids there. So let's talk about it. When we look at children, just like when we watch that video of the child sleeping, it's difficult for me to watch because I know how much he's struggling. I see children like this all the time. Maybe some of these pictures will remind you of your own children. Is this a healthy child? When I look at this little girl on the left, she's cute as can be, right? Cute as a button. But look at those dark circles under her eyes. When I look at her face being asymmetrical, meaning as cute as she is, that lower third of her face down here is underdeveloped. It's a lot shorter than the rest of her face. When that's so much shorter, that means things are closed off, which means her airway isn't as open to get air into her body, oxygen to her body. I'm going to show some more pictures of that in a minute. Same thing on the little boy on the right side. He doesn't look very healthy to me either. How can we expect that boy on the right to go to sleep and wake up and as exhausted as he is, and then go to school and perform? It's difficult, if not impossible. How about these kids here? Are these healthy children? I look at the girl on the left, I look at her ditched in chin, and I wonder how great is her, or how compromised is her airway? How well can she take in air when she's sleeping, or even in her daily life? We can really help with that growth and development. Great, so what are some other things that we can look for? We can look for the outward appearance of these children, that they're exhausted, that their lower jaw is undeveloped. We can look for anterior open bites when the children bite down or their teeth open in the front. That's typical of a thumb sucker. We see a lot of children who are thumb sucking. I get that question asked all the time. When does my child need to stop sucking their thumb? And it's not just a thumb, it's a pacifier, or, there's a whole line of designer jewelry built that the mom can wear that the child can suck on. It's very popular here in Dallas. So what is the appropriate age? Many pediatricians will say, 2, 3 years old. We know because of the growth and development of this child's head that as soon as we can get them to stop sucking their thumb or stop their sucking habit, the better the more normal their growth and development of their head will be. So we have a great option with the first appliance of HealthyStart, which I'll show you here in a little bit, which is called the Habit Corrector. We look at this little girl here. She's 6 years old. She still sucks her thumb. She is probably in kindergarten or first grade, and she is probably being made fun of in kindergarten or first grade for sucking her thumb and maybe even having the malocclusion that she has. So if we're able to help correct that habit and get her back on track, that's really important. When we talk to a lot of parents about thumb sucking for this older age, a lot of times there's some shame associated with it, not only with the child who knows, okay, this is kind of baby, I shouldn't be sucking my thumb in kindergarten or first grade. We can have some 3rd and 4th graders who suck their thumbs. There's a little bit of shame surrounded both by the child and the parent. We find that if we can give them an option that will work, that will help them break this habit and replace it by wearing the appliance, they're very open and excited about it. We're also looking for improper tongue swallowing. Now, when we look at a child and how they swallow, we don't want to see any muscles of their face move when they swallow. So when they swallow, if you can see the tiny little box of me in the corner, when I swallow, you're only going to see the muscles of my neck move. Okay? I'd like you to watch your child swallow tomorrow morning at breakfast and see if potentially they put their tongue forward, which is called an anterior tongue thrust. I'm going to take a sip of water and try not to spit it out all over the screen to demo what this anterior tongue thrust looks like. Now, that was very exaggerated. Your child doesn't have to be that exaggerated, but if you see the lips, the muscles of the lips and the chin and the cheeks work to pull together to keep that liquid in, you can be very suspicious of an anterior tongue thrust in your child. So it's going to end up into teeth that look like this. And it'd be very difficult to correct. We'll talk about that here in a little bit. We're looking for excessive overjet, which means those top teeth stick out really far from those bottom teeth. We're also looking for excessive overbite, where the top teeth cover the bottom teeth. We're looking for flared upper incisors, so you can see that space there in between the 2 top teeth. And ideally, we want those to be together. We're looking for any sort of crossbite, meaning when your child bites down, we want their top teeth to fit on the outside of their bottom teeth. And if your top teeth fit on the inside, like you see there on the left side of this picture, the patient's right side, that's something you want to pay attention to and something you should be concerned about. We're going to look for these bottom teeth that are tipping back really far, or these top teeth that are tipping forward very far. We're also going to look for, again, any tongue position that's abnormal. Now, normal moms and dads, they're not looking at how their kids swallow. They're not looking at how their kids sleep. So a lot of this is new information. One option you have as a parent is, of course, to evaluate your child, but also to look up on the HealthyStart website to find a provider in your area who can go through this whole assessment for you to really recognize any of the signs and symptoms that your child might have. Let's take a look at this. This is a little bit of a weird slide here with the skull, but what this is showing is that the normal craniofacial growth of a child from ages 2 to 17. The really important takeaway of this is, if you could see at the bottom of the slide, by 12 years old, 89% of growth in a boy and 94% of growth of a female has developed. So gone are the days that it is acceptable to wait for a child to be 12 years old to go to a traditional orthodontist to then make changes in their dentition for traditional braces. The HealthyStart system really concentrates on the growth and the natural growth and development of the child. So when I'm talking to parents, and what really resonates with me as a parent for my own 3 kids, is you kind of have 2 options. You can look at a 2-year-old who is only 55% developed. That's why their head is 55% developed. That's why a lot of 2-year-olds look like little bobbleheads, right? They have little bodies and little heads, at least my 3 did. We know that there's still 45% growth and development left of that head. So we were able to eliminate some of these bad habits that 9 out of 10 children have, get them a proper night's sleep, and then simply help guide the natural growth and development of their craniofacial growth into the proper position. It's a much more conservative, predictable way to do things versus waiting until a 12-year-old, which is 89%, 94%, depending on a boy or a girl, developed. We don't have a lot of growth to play with to help account for any of the changes that we might need to get those teeth into the proper position. When I talk to parents and I tell them this, these two options, most parents really appreciate that they would appreciate the earlier intervention that works with their natural growth and development. Very few say, no, let's wait until there's no growth and development and then make changes. So it's been a great partnership with the parents in my practice here with a very proactive, comprehensive solution that we can offer with HealthyStart. So why are so many children not experiencing normal growth and development? Okay, how come so many children need braces? Why are children not sleeping as well anymore? Let's talk about that. It's because of some of these bad habits. It's because of prolonged nipples and pacifier use. We really want to cut that off at 6, 8 months of age. Now, I don't make any friends with any moms by saying that, trust me. When I say, nope, get rid of that pacifier at 6 months or 8 months, they're like, are you kidding me? I understand that. But if I'm not saying get rid of the pacifier, stop using it. I'm saying replace it with something that could help your child grow and develop in the natural way with the HealthyStart appliance. That prolonged use of the nipples and the bottles teaches an improper tongue position, which then you have an improper swallow. The child then becomes a mouth breather, has an open bite. Maybe they're a thumb sucker. It interferes with that natural growth and development. When the jaw doesn't grow and develop naturally forward, it compromises the size of the airway, the tube that connects your mouth to your lungs. So if the tube isn't as big to take air into it, you get a lack of oxygen. Not having enough oxygen reduces or eliminates REM sleep, that level of sleep that is restorative and reparative, the stage of sleep that we all want as grown adults because that's the anti-aging cycle of sleep. By affecting the REM sleep, that affects the neurological, endocrine, and the immune system. And then it results in these sleep disordered breathing symptoms that we were talking about, like aggressive behavior, ADHD, tooth grinding, nightmares, all of those types of things. So it's a big loop. Long-term effects of sleep disordered breathing. 50% of kids are held back 1 grade. 30% are held back 2 grades. This is frightening to me. 50% become alcohol or drug addicted in their teens. Life is hard enough as it is. It moves fast, definitely moves faster than when I was in high school. And in middle school, some of the choices that these kids have, I want to reduce their risk as much as I can for them to be the best, healthiest versions of themselves, short of locking them in their room, which is still an option when they're teenagers. I'm not ruling that out. But anything I can do to reduce their risk is very, very important to me. And I think it is for all parents everywhere. Again, other issues. Why do we have this underdevelopment of the lower jaw? I think as parents, and I am right there with everybody, we're so afraid of our children choking that we feed them this very soft diet for a long time. There's the graduate puffs. I don't know if anybody's had a baby recently, but these puffs, you put them on your finger, and as you feed it to your child, if you don't do it quickly, they almost dissolve on your finger. So these children aren't using their muscles and their jaws and working to help develop them. So I understand I didn't want my kid to choke either, so I was happy to give them dissolvable food, but that is a reason why they don't have this normal growth and development like we've had before. We see open bites like this as a result of pacifier or prolonged nipple use or bottle use and resulting in finger sucking. Now, here in Dallas, bottle feeding versus breastfeeding is a very, very hot topic. It's a very sensitive topic for a lot of moms and dads because I find that most moms, they do the best they can. And if that means bottle feeding, then that is sometimes the best they can. So we really work with parents so that if the only option for their family, if the best decision for their family is bottle feeding, and they maybe don't have the musculature development that they may have received if the child was breastfed, we're able to work with them with the series of appliances to rebuild that. And it really makes a lot of parents, especially moms who are concerned that their children are bottle feeding, feel much better about that decision for their family. Great. Let's talk a little bit about airway. Now, I know this is kind of a boring slide, but bear with me here. We're looking at a child from the side here. Ideally, the child will take air in through their nose. The nose will filter, purify, and humidify the air before introducing it into the lungs and into the body so that the body can take the oxygen all over to the brain, to the heart, urinary system, endocrine system, and so that it can function normally. What we see is a lot of children take air in through their mouth, through mouth breathers. I actually see a lot of adults. You guys go out to dinner this week, sit in the restaurant, instead of thinking about what you're going to order, play who's the mouth breather. You know, you're welcome to come out to dinner with me and my family. That's the game we play. Mouth breather, mouth breather, mouth breather. We know that's important because when you mouth breathe, you take air in through, I just sounded super nerdy that I admitted that my family does that at dinner. Let's pretend like I didn't say that. Sorry, guys. But I get off track here. Pretend you take air in through your mouth. You're now relying on your tonsils to filter and purify the air and clean it before it is introduced into your body to then help your body function. Problem is your tonsils aren't meant to do that. Your tonsils are lymphatic organs. They're not supposed to work like your nose does. So the tonsils are having to work harder and harder and harder to clean that air. So these children that have very enlarged tonsils and are getting throat infections, is that because they are sickly children? Is that because they're more at risk or they're in kindergarten and the kids are grimy? No, it's because their tonsils are having to work so hard. They're not purifying the air like they can to introduce it into their body. My daughter Franny, for example, had such huge tonsils that they were kissing. Which means they were touching each other. She was a mouth breather. She snored. She woke up with nightmares in the night. Imagine, I have this sweet little 2.5-year-old, my first child, wake up in the middle of the night, Mom, help me. I go running to her room. She's asleep, having a nightmare. It was awful as a mother. So for her, because she was such a strong mouth breather, I actually chose to have her tonsils and adenoids removed to open that airway. Well, that's great. We removed the tonsils, but now we need to retrain Franny to be a mouth breather a nose breather so that she's taking air in properly. We were able to use the HealthyStart appliance, the first one in the stage, which I'll show you here in a minute, to help reestablish that nasal breathing. What's great about Franny is she grew 3 inches in 6 months. As soon as we took her tonsils out and we reestablished nasal breathing. It's because by reestablishing nasal breathing, she was getting higher quality oxygen and air into her body, which was able to be dispersed all over her body, and she was able to reach that REM stage of sleep, the restorative and growth phase of sleep, and she shot up like a weed. It was incredible. No more nightmares or anything. Compliance with Franny is very easy. She knows if she doesn't wear her appliance, she would have a nightmare. And she remembered her nightmares, which was horrible and makes me feel terrible as a mother that she remembers anything other than unicorns and cupcakes while she's sleeping. So the fact that she had bad dreams, she knows she will not go to sleep without her appliance in. So she's done extremely well in reestablishing her nasal breathing. So most common problem with improper air exchange to and from the lungs is due to nighttime mouth breathing. And that's present in about 43% of the sample. So I see a lot of children who mouth breathe, especially when they watch TV. They kind of sit in front of the TV, with their mouth open, the forward head posture. But I would encourage you to watch your children during the day and maybe even sneak in on them at night to see if their mouth is open. You can see this child here has her mouth open, so she's not getting the quality air that she needs. Here's a picture here of a child. This is a sideways picture x-ray of the child. Where those 2 blue arrows are on the left side is showing a very small airway. So that child's taking air in through their nose and then through that really small, almost the size of a coffee straw, so small, into their body. Compare that to the 5-year-old on the right side who has where those blue arrows are pointing, a much wider airway. Imagine the quality and the quantity of air that could pass through that child. Now, the great thing about the HealthyStart series of appliances is actually this appliance will help guide the downward forward growth of the mandible. What does that mean, right? Who cares? That sounded weird. The bottom jaw there, and I'm pointing my computer screen like you guys can see it. This is crazy. I apologize. Let's see how good I can do describing it. On the left side, the bottom jaw, by wearing this appliance, the bottom jaw will move downward and forward towards the chin, which will then open the airway. I have another picture here in a minute that I'll show you. But the natural growth, which we saw in that other picture, of the jaw is downward and forward. So this appliance is only promoting the natural growth and development of a child. We're not turning these kids into little Jay Lenos with the huge chin. Don't get me wrong. We are merely removing the interference, removing the bad habits that's causing the child to have an underdeveloped chin and putting the child in the correct position where they're supposed to go. I hope that's clear. Here's a great picture of this little girl, underdevelopment before and after. So if you look at her chin on the left, you can see that it's ditched in, that her little lower lip is further back from her top lip. And then after wearing the appliance, you can see even after a couple of years of growth and development, so we still have growth and development left of a 7-year-old, correct? You can see how we brought that forward, and that's going to open that airway. So if we go back to this picture here, you can see how small that airway is on the left, and then how much bigger it got just by bringing that lower jaw forward here on the right. It's pretty amazing, actually. So what does your child's airway look like? Is it a coffee straw or is it a garden hose? Our goal, and I would challenge you, if you think that you breathe really well and you think your airway is very open, I would challenge you to pick up a coffee straw next time you're at Starbucks and place that in your mouth and take a big breath in and realize it's almost suffocating and claustrophobic to feel how small that is and how that feels when you take it in. If you feel like you have a very small airway, take not necessarily a garden hose, but take a big Slurpee straw or a smoothie straw or wherever you can get one and take a big breath through that. That's what it should feel like. It'll give you some empathy on how your kids are maybe breathing. You know, we talk a lot about, I went to Starbucks one time and stole every straw from the store so that we could kind of compare that versus a Smoothie King smoothie straw. So we keep those in the drawer so that we can really talk about it back and forth so the parents and children can really feel the difference between these two airways. And we talk about how we can turn their coffee straw into a smoothie straw. We're really scientific here at Central Dentist. But we actually, parents understand that and they want their children to have garden hoses. So we actually have parents call sometimes and say, you know, I think my child has a coffee straw. I want them to have a garden hose. Can you take a look at it? And we're going to take a look at a picture here. We do take 3D CBCTs in my office, which allows us to do some imaging and really measure the volume of air that can go through. So in this child here, on the left side, we made a color image of this. This child has their mouth closed. That curvy thing in the front is just the bite stick that the child holds to hold their head still. Someone asked me if that was the tongue one time. It'd be kind of a funny tongue. But this child has their mouth closed. And you can tell the color starting from the blue at the top, green, yellow, orange, that's their airway. That's a very healthy airway. This is a child that we've treated for 3 years and to promote that downward forward growth of their jaw. She is now breathing through a garden hose. We had a garden hose party for her where we got her balloons and celebrated what great success she had for opening that airway. She's a much healthier girl. She's one of the tallest girls in her class. She used to hate reading and hate spelling, not because she's not smart or not because she isn't good at it, because she had such a hard time actually sitting down and concentrating. And it's because she never got into she never had a restful night of sleep. So this girl has gone just full circle and we couldn't be prouder of her garden hose airway. Here's another little boy, one boy sleeping. Here's another one. Here's what's interesting. Parents sometimes say to me, you know what, I have certain landmarks in life that we're going to hit. 5 years old, they go to kindergarten. 12 years old, we do braces. 16 years old, they drive. 18, they go to college. 21, they get arrested for drinking too much. Just kidding. But they have these landmarks of things that they're going to hit, right? I think we do as parents. So when I bring up the conversation to parents about how the quality of their sleep or even the growth and development of their jaw so that they can have straight teeth without braces, especially when I bring that up in a 2-year-old or a 3-year-old, it really catches parents off guard. And maybe there's parents listening tonight that think, this doesn't relate to me. I have a 2 and a 3-year-old, or I have a 6 and a 7-year-old. I'm not ready to talk about getting straight teeth. Braces are coming at 12. I'll tell you this is a really important thing. Mouth breathing while sleeping causes airway constriction. We know that when they have their mouth open and they breathe through their mouth, they're getting less quality air. They're not sleeping as well. They're not growing and developing the way that their bodies are designed to grow and develop. They will have lots of outward signs and symptoms of sleep disorder breathing that will make them struggle. Now, here's the really take-home point that gets parents' attention. 82% of children from the age of 2 to 12 don't improve. So For sure. If you want to take that gamble, your child is part of that 18% that will improve on their own, go for it. I can't push you, but if you think that maybe your child is part of that 82% that won't improve on their own, don't you want to do something now? If you see a problem, don't you want to solve it now? You don't want to kick it down the line and say, yes, there's a problem. I'll come talk to you about it in 10 years or 7 years, especially when it comes to our children. If there's a problem, the parents in my practice here, and as a mom myself, I want to fix it now. I don't want to wait. And so I think it was a really interesting study that came out last year that 82% of kiddos don't get better. Let's watch this kid sleep here and see if we think this kid's getting a restful sleep.
That was holding it. He's still holding it. He's trying to take in air. There he goes. Now watch. He's holding it. He's holding it. He's holding it. He's holding it. He's still holding his breath. He's going to gulp again. There he goes. That is it again.
So again, an absolute heartbreaker. We have this sweet little kid who's leaning back, opening up his mouth and gasping for air. What we'll see in this video here in a second is the mom actually places her hand into the child's mouth, into Eli's mouth, and pulls the jaw down and forward, simulating what the HealthyStart appliance will do to open it up to then open the airway. So let's watch. If you'll notice here on Eli, look at the musculature of his face. Look how he's straining. Look how uncomfortable he looks. I'm going to now fast forward here to when the mom helps Eli breathe, and let's see how the musculature and all of that changes when she does that. There we go.
When I take its jaw and I just bring it forward, if I can, let's see if I can. And I open his airway. Just bring his airway forward. Now let's do the quiet breathing. There we go. Now he's breathing through his nose.
So we see Eli here, his sweet mom here brought his jaw forward in the car seat. I don't think she's driving, right? She's probably parked, which is great. She's pulling it forward, and just by reestablishing nasal breathing, having Eli breathe through his nose, look how much more peaceful and restful his sleep appears. It's really quite extraordinary, actually, that just opening that airway makes that big of a change. And that's one thing that these HealthyStart appliances do. Not only do they open the airway by wearing the appliance, but they promote that downward forward growth of jaws so that the airway is permanently opened. So this isn't just a Band-Aid that we're putting on Eli temporarily. We're actually helping promote the proper growth and development so that it'll correct for a lifetime. This child here, Eli, after wearing this appliance, he won't be a sleep apnea patient. He's not going to snore and drive his wife crazy in 30 years. He's going to have restful sleep for a lifetime. And parents can't believe that's an option that they can give their children. And I'm very proud and very thankful to say that I am a result of one of these appliances. By wearing this when I was younger, it helped promote the downward forward growth of my jaw, opening my airway, aligning my teeth straight so that I didn't have to wear braces, which I loved because all my friends had braces and I didn't have to have them. And I sleep beautifully now. Not to rub it in, but I really do. I put my head down and I sleep really well and wake up rested. And I really want that for everybody because I can't imagine life is hard enough. I can't imagine going through life really, really tired. So that really speaks to my passion for this because I think everyone deserves a good night's sleep. Okay. Let's talk a little bit more about how this all fits together. We have mouth breathing and snoring, which we know what a big issue that is. We definitely want them to be breathing through their nose. We get that mouth breathing and snoring from using bottles or pacifiers too long, putting the tongue in the wrong position because they do have that pacifier or bottle in. Sugar, processed foods, we talk about how that can alter the growth and development. Poor oral habits, thumb, finger sucking, tongue thrust, that type of thing. That establishes that mouth breathing and snoring. Get the kid off on the wrong track, actually. By mouth breathing, we know that reduces the airway, that closes the airway, restricts the airflow. So we get the oxygen and carbon dioxide balance off. That's going to affect the brain, the immune, and the endocrine system. It's going to make the tonsils work so hard to try to clean that air, the air that's coming through their mouth. Here, the air in Dallas is not as beautiful as it could be. Like the Telluride picture I showed you, the air is much cleaner there. So those tonsils really have to work for these mouth breathers in Dallas. We see that they get swollen. The low tongue position, the tongue in the wrong position. Then we see an underdeveloped dental arch, underdeveloped mandible. We saw that lower jaw, how it was dipped in. We saw it in the lip posture of that little girl earlier. And the crossbite, those top teeth sitting on the inside of the bottom teeth. We see all of those things. That then leads, with that compromised airway, all of those imbalances then lead to sleep disordered breathing. And those are the symptoms that we can recognize in our children. Restless sleep, ADD, ADHD, bedwetting, chronic allergies, nightmares, daytime drowsiness, aggression, difficulty in school, and frequent infections. There was a really interesting study that came out last year that looked at a group of children, and some of them had ADD, ADHD, and some of them have sleep disordered breathing. 50% of the time, children were misdiagnosed with ADD, ADHD, and they in fact had sleep disordered breathing because these outward signs and symptoms so closely mimic each other. It's very easy to say, yes, they have ADD, ADHD, when in fact they do have sleep disordered breathing. We have several patients in our practice. I could tell stories that would make us all cry about these incredible kiddos who are super smart and just have so much potential, but have a lot of these outward signs of or they've been diagnosed with ADD, ADHD. Their mothers, for one reason or another, have decided, even though the pediatrician has pushed them, even though the school counselor and the teachers have pushed them to try to medicate their children, for their family, that wasn't the right decision. So when I talk with these moms, I say, hey, ADD, ADHD is an absolute, very real diagnosis. I understand that you don't want to medicate your children. So what if we try this? What if we help your child become, to breathe properly through their nose? We help them get a better night's sleep. Let's see what happens with some of these outward signs and symptoms. And I'll tell you, with each of the children that we've treated, these signs and symptoms that we see have all improved. Now, some of these kids that have ADD, ADHD, we've seen improvements. And they still need to have medication, but the amount of medication that they need for the ADD, ADHD is much less than if we hadn't treated the sleep disordered breathing. It's been probably one of the most rewarding things I've been able to do when I partner with the parents in this practice, because we're able to see this awesome kid just become a better version of themselves and really just soar after getting a good night's sleep. It's really amazing. Bedwetting is the same. We see children all ages bedwet. Now, I'm not talking about the 2 or 3 year old who isn't potty trained during the day either. We're talking about the child who is potty trained during the day, having accidents during the day, then has accidents at night. These kids typically range from 4, 12, even 13 years old. I see moms try and dads try everything. Princess panties, which are the pull-ups that girls wear at night. We see young boys, 8 and 9 years old, who are just dying to have an overnight slumber party with their friends, that are too embarrassed because they're bedwetting. We see, and the research isn't totally clear as to why bedwetting and sleep disordered breathing are linked, but most of the research is pointing towards the concept that because we have a compromised airway, because we take in compromised air where the oxygen and carbon dioxide aren't the right balance, that messes with the endocrine system. Endocrine system is the one that releases all the hormones to keep our body in balance. When that's not in balance, all the systems in our body don't work properly. So while it's not set in stone exactly which hormone, which pathway, scientists feel very confident that it is the imbalance in the endocrine system that causes these children to wet the bed at night. HealthyStart providers around the country that I've talked to that are helping these kids are all sharing the same stories that I get to share with my patients here in my practice, and we're having great success with these kids that are bedwetters. The first night that they're able to wear the HealthyStart appliance all night, we're seeing the bedwetting stop. It's that quick and it's that much fun. So we're seeing, moms who come in tears because their children can never have a slumber party. They have the appliance, they come back a month later and they're like, what was I thinking? My kid had a slumber party, they were up till 4, I'm exhausted, what was I thinking? But we see the pure joy that they have the option of having the slumber party because they're able to wear these appliances and breathe through their nose and have the natural balance in their body. It's been really great. So as a dentist, what can we do? What can dentists do to help these children with sleep disordered breathing? Here's the really cool thing. We get to fix it. We're not just giving them Band-Aids. We're not just giving them temporary fixes or writing a prescription. We can actually fix it, which is really incredible. Here's how. We're going to use the HealthyStart series of appliances. Now, a little background on HealthyStart. I know Kathy talked about this a little bit, but let me touch on this again. There's over 3 million cases worldwide treated successfully. 3 million, that's incredible. It's FDA approved, it's medical grade material. There's never been a documented case of a child wearing this appliance and being injured or anything negative at all. Of over the 3 million cases worldwide, it's been great. Here is a picture of what these appliances look like. I like to, and there's a whole series starting with the toddler habit corrector all the way through the adult dentition for 13-year-old and everything in between. I'll tell you, all the appliances do things they have in common. They're all removable. So this is something that typically children are not wearing to school. The younger the child, the more growth and development they have, the more likely they can wear it at night only while they sleep. So all we have to do is figure out in your bedtime routine when the most logical and easy time to incorporate that in the nighttime routine so they sleep with it through the night. The older they get, for the 9, 10, 11-year-old, we know a lot of that head and neck growth has occurred, and so sometimes they have to wear the appliances actively during the day in what we call exercise, and that typically can be 1 to 2 hours a day, not all in a row. I like my patients to wear it about 20, 25 minutes at a time. So a little bit in the morning, a little bit after school, doing homework, driving in the car, that type of thing. Screen time, which maybe there's a mom out there and their children don't get any screen time. I applaud you. My children have plenty of screen time, so they're able to wear their appliances while they watch TV if necessary. These appliances, we tell little kids, we ask them if they sleep on a pillow at night for their head, and of course, well, most of them say yes. Some of them have some weird answers, but most of them sleep on a pillow. We tell them this is just like a pillow for your teeth, for your mouth. You put it in and it's nice and soft. We let kids feel them before we put them in, and most children like them and they're eager to put them in their mouth. So it's great. I also love it. As a mom, I worry about, especially my 2 sons. Sometimes I look at how dirty their socks are and I'm just like, oh my goodness, how well are you brushing your teeth? It's crazy. So I love the fact that these appliances are removable, because sometimes with young boys, young girls too, but specifically my 2 young boys, I worry about their oral hygiene. And so what's great is these are removable so that we can still practice brushing our teeth really well. There's other appliances out there that are cemented in, and children are unable to take them in and out. And that always worries me, just because who wants cavities for their kids, right? So HealthyStart corrects, just to reiterate, tongue thrusting, abnormal swallowing, which everybody's going to check tomorrow morning at breakfast and make sure none of the muscles of the face are moving, only muscles of the neck. Mouth breathing, again, abnormal tongue position, thumb and finger sucking. It's going to correct it by replacing the habit. It's really hard to tell your kid, okay, stop sucking your thumb. You can use the nail polish. I actually think that nail polish tastes pretty good. You can use all kinds of things that they have on Amazon. They're like medieval torture devices for their thumb. We found the most effective way, instead of breaking a habit, is to replace the habit with the appliance. So instead of putting your thumb in at night, you're going to put the appliance in instead. Open bites, flared teeth, spaces in between their teeth. We talked about an underdeveloped mandible, that little ditched in mandible, and even a narrow palate. So that crossbite, the top teeth fitting inside the bottom teeth. This picture here was, these are my 3 kids. Last summer we went to Disney. That's Disney there in the background. You can tell 2 of them are pretty excited. One of them is not so excited. We got to the hotel with bathing suits on. He put his appliance in. He went outside and saw the Disney castle and said, yay! And he spit it out the 13th floor over the balconies and expected me to go find it. But he was very upset because he was worried if he didn't wear his appliance, he wouldn't sleep as good, so he wouldn't have as much energy to explore Disney. So I thought that was pretty awesome that my 4-year-old was able to articulate how much he loves his appliance. And no, I did not find his appliance. It's somewhere in the parking lot at Disney. If anybody finds it, feel free to send it back for little Vinny there. Good. So HealthyStart. Again, we are going to look for HealthyStart to fix a lot of these developmental issues. We're going to expand the arches, expand the top and the bottom jaws. That's going to open up that airway. We're going to establish nasal breathing, have them breathe through their nose like the way they're supposed to. We're going to retrain their tongue. So some of these bad habits that they've received with their tongue, we're going to retrain it just by wearing the appliance. The child is incapable of swallowing improperly if the appliance is in place. It's great. Let's say a child swallows 800, 900 times a night. They get 800, 900 correct repetitions of swallowing by having that appliance in at night. It's amazing. We're also going to eliminate the bad habits. So instead of breaking a thumb sucking habit or breaking a pacifier habit by having the passy fairy come or cutting the tip off and just having a little bit of the pacifier to put in, we're actually going to have, reward this kid. Hey, you're such a big kid. I'm so proud of you. You're now going to wear this appliance. I'm going to take the pacifier. We see kids really jump on that, and they're all for it. We're going to advance the bottom jaw, like we looked at those slides before, to help develop that airway. We're going to encourage the proper facial and body growth, and we're going to get them into that REM cycle of sleep so they're growing and developing properly. And we're going to correct most of the orthodontic problems that they would have. So rather than waiting until the age of 12, we're going to correct and guide those teeth into the proper position from an early age. Let's talk about that for a second, because a lot of times people say, okay, you're telling me you're going to help my child sleep better. You're going to correct all their bad habits, and then you're going to put their teeth in the correct position so they don't have to wear braces. I've actually had a few patients say, this is too good to be true. There's no way this can happen. And so what I say to those parents is, hey, listen, I know it sounds really great, but I want you to trust me. Here are some of the other pictures we have. Go out there and read what other parents are talking about. And I would encourage you to do the same thing. Like HealthyStart on Facebook, join the conversation, find out what other parents are saying. But I tell the parents this: if we are able to eliminate the bad habits, get your child a good night's sleep, and teach them the proper way to breathe and swallow and speak, if we can do that at a young age and then just get out of the way so that their body can grow and develop the way they're supposed to, all of their teeth will be, their permanent teeth will be in the proper position by the age of 12. They won't need braces. If we can correct the habits, the anterior tongue thrust, for example, the tongue coming forward when they swallow, that was a funny demo. I hope there wasn't a delay on the internet because that would look really weird. But if that anterior tongue thrust, pushing the tongue forward, which is going to spread those teeth out, if we can correct the tongue, then we can put the teeth in the correct position and they stay there. As a tooth erupts, so as a baby tooth is lost and a permanent tooth erupts in the bone, it's very easy to move that tooth because there's nothing attached to it. Once the tooth is erupted in the bone and it comes through and we can see it in their pretty smile, there's something called periodontal ligament fibers, which are hundreds of thousands of little fibers that attach to every tooth and hold it into place. So again, I give my patients two options. Option one, we can correct the habits and then allow those teeth to erupt, put those teeth in the correct position where they're supposed to go so that all those fibers can attach to them. And then, by the way, those fibers stay there, so they'll never need a retainer because the tooth is in the right position and it's being held there. Or we can wait until they're 12 years old and all the teeth have erupted, and now we're noticing the teeth are crooked and malaligned, and we can put an external force like braces on there and then move the teeth by tearing fibers on each tooth and moving the tooth slightly. If any of the parents out there that are listening had braces, you probably remember going in and getting your braces tightened for a month and how painful that was. What was happening when they tighten those braces is they're micro-tearing those fibers to move the tooth, waiting for those fibers to reattach. You go in, they tighten it again, they tear those fibers, move the tooth a little bit, and reattach. What happens is you get this beautiful smile when you're 14, 15, and then you're 25, 26, and those fibers over time go back to their original position, which is why we have a lot of adult patients who want Invisalign or orthodontics done again because their teeth aren't as straight as when they were teenagers. The really exciting thing about HealthyStart is we can actually put that tooth in the correct position as it erupts so the fibers attach to that tooth where it's supposed to go. And by the way, we've corrected their habits. We've corrected their tongue is in the right position. They're breathing properly. They're getting a good night's sleep. So those teeth will stay where they are. It does sound too good to be true, but if you think about it that way with your two different options, it seems very logical that correcting those habits and then allowing the teeth to go in the correct position by guiding their natural growth and development by using forces of their tongue and their natural biting forces with the appliance is a much more natural and conservative way to do it versus gluing braces, for example, which is metal, gluing an external metal force and then applying that force. That was a funny braces demo. I can't see anybody else. You guys can only see me, so I don't know if you're laughing or rolling your eyes, but that's my braces demo, just so you know. All right, great. Let's jump back on this slide here and take a look at the airway. Again, this is an x-ray taken from the side of a child who on the left has his mouth closed. We can see the blue arrows pointing to that airway. The airway on the left, I would call a garden hose. That's good. That kid's taking air in through his nose. There's plenty of room to take high quality air in through his airway and deliver that to his body. Let's look at the same child on the right. Now he's opening his mouth, very small, just limited opening to simulate mouth breathing. The x-ray was retaken. Look where the blue arrows are now showing what the airway is doing with a mouth breather. He just turned that garden hose into a coffee straw. So while the healthy airway is there, he has a habit that's preventing it from being where it needs to be. So if we're able to correct his mouth breathing and reestablish nasal breathing, that kid's going to do much better. So I think that's a very good slide to illustrate that. Good. Let's talk about some of the before and after cases. Let's talk about this child here. This 9-year-old, almost 10-year-old here. We have flared incisors, lots of spaces, overjet, kind of a goofy looking kid here on the upper left. By wearing these appliances, we were able to align these teeth, and he has a funny double tooth on that lower right. We were able to get a great midline, a beautiful smile, all teeth in straight, and that shows the retention there at 25 years old, and the kid not needing braces. Let's talk a little bit parents in my practice and a lot of mom friends that I have are really concerned about and talking about. There was a study recently, I talked about it, and another study actually by Dr. Bonnick that talks about sleep disorder breathing increases the risk of ADD, ADHD by at least 50%. ADD and ADHD patients have little or no REM sleep, but they have delta sleep. I think delta sleep is going to be a very kind of hot topic here that everybody talks about. There's going to be a lot of books written about it. There's a lot of research coming out about how delta sleep affects a lot of issues when older, early onset Alzheimer's, all kinds of things. So even hearing, hey, my kid is at 50% more risk of ADD, ADHD because they have sleep disorder breathing, let's reduce that risk and make sure they're sleeping really well. I told that story about the parents who don't want to medicate their kids for ADD, ADHD, and so we try to get them a good night's sleep and see how much improvement we get with their kids. This is a really cool image here that was generously loaned out from the University of California. This shows a child on top, an MRI of normal brain function. So if we look at that top row, we see color, we see red and yellow, that's brain activity. So that kid's thinking pretty good, everything's going really well. Let's go down to the bottom, brain function with 1 night of sleep deprivation. Okay, so just staying up all night, 1 night. Look at the lack of activity on that brain. It's absolutely amazing. Now we're expecting that kid to now go to school and perform, to do well in with really high expectations in science and math and spelling and sit still and have good manners and go to lunch and all of these things, and then after school go soccer practice or after school care or karate or whatever your kids are involved in. And this is just after 1 night of sleep deprivation. Imagine a 7-year-old who never had a good night's sleep in their entire life. Imagine what that brain activity would look like. It's absolutely overwhelming to think about the pressure that we're putting on our kids, and not necessarily pressure in a bad way, but the expectations that we have for these children and how we're expecting them to perform, and their brains just aren't capable of it. So it's not that they're not a good reader, it's not that they're not good at math, it's, hey, their brain has no activity because they are absolutely exhausted. Let's get them some rest so their brain can function properly and stand back and watch what these kids can do. Good. Let me show you a few more pictures here, and then I'll be very eager to take some questions if we have any. HealthyStart straightens teeth. We talked about how we can guide those teeth into the proper position before those fibers attach and hold them still. So here's some pictures here we can take a look at. If you'll notice on the lower left, we notice those teeth are malaligned. There's not really room for all of them. After treatment for about 6 or 7 months, the result is there on the lower right. Now, again, this is achieved with an appliance that I showed you here before. That's a removable, soft appliance that is worn mostly at night, at night only to achieve this result. It's pretty incredible. Let's take a look at this one. This child was treated for a year. You can tell these pictures, the top row are the top teeth, the bottom row is the bottom tooth. So you can see the top teeth there are malaligned. They're coming in kind of crooked. There were some bad habits associated with this child. So we were able to correct those habits and then guide those teeth into the proper position. If I look at, if I look at that upper right picture, that's a pretty gorgeous smile there, something to be really proud of. And that's a 11 or a 12-year-old in that picture. So their friends are just now getting braces on their teeth, and their teeth are that straight. Let's take a look at the bottom here. You can tell there's a baby tooth that's kind of hanging on the lower right side of that picture. The permanent tooth is coming in behind it. We get a lot of kids that come in and say, oh man, or a lot of parents say, oh man, what do I do? Do I pull it? What do I do? And so by wearing this appliance, we can actually, the baby tooth does come out, and then we can guide that permanent tooth right where it's supposed to be. That's a beautiful picture there on the lower right. And the good news is we're able to guide that tooth in before all those fibers attach. So now that tooth is in the proper position, the fibers attached. So guess what? This child here, those teeth will be that straight when they're 25, 30 years old, because we corrected the habits, we put the teeth in the proper position, and then the fibers attached. So is it too good to be true? Maybe, but regardless, it's a beautiful smile, and it's a healthy, confident kid at 12 years old who feels really comfortable smiling and talking in front of their class, I'm sure. Here's another one here. This child was treated at 5 years old. You can tell she has a little ditched in chin, just a smaller chin. Her little lower lip is smaller than her upper lip. Still such a cute girl. With this appliance, we were able to guide that downward, forward growth and development. Here she is at 8 years old. We see that bottom jaw and the top jaw fit together really nicely. It's just really pretty. You know, depending on, I'm not a psychiatrist or psychologist, but some of the books I've read as a mom, sometimes some of these books cite that by 8 or 9 years old, it develops your personality. I don't know if I believe all that, but you know, if I were to think about it, think about what you were like at 8 or 9 years old. When I think back at 8 or 9 years old, my teeth looked very similar to this little girl. I had most of my teeth in the proper position with alignment. I was sleeping really good. I was a healthy kid. And I think back very fondly of being 8 or 9 years old. I felt very confident getting up in front of the room and talking, which I think really worked in my favor. I think about some of my friends who had, you know, malaligned teeth or permanent teeth with baby teeth and kind of a mix, and they were all kind of jumbled, who didn't necessarily smile as much. And that makes me sad because there was another alternative to it. So I really attribute HealthyStart to my personal growth and development, my personality, which I think is a good thing. Maybe you could ask my husband, maybe it's not a good thing, I don't know, but I think it's a good thing that it helped me become very confident at a young age, because I felt very confident smiling. Don't worry, I was made fun of for other things, just not my smile. So kids always find something, right? Here's another child here, an 8-year-old. Kind of goofy there on the left with space in between his teeth and quite a bit of overbite and overjet. Not a heavy kid by any means, but if we look at this picture of the 8-year-old, you can tell he had a slight double chin. That's really from the underdevelopment of that jaw when we were able to bring it forward. As you can see, from 8 to 9 years old, bring that bottom jaw forward and align those teeth. A really good looking kid at 14. But really those corrections we're seeing in as quickly as a year by wearing that appliance at night, and he exercised with that appliance a little bit during the day as well. Really a great case there. Good. There is an excellent video. It's called Finding Connor Deegan. I'm not going to play it here now. You can YouTube it. It's a public YouTube that anybody can watch. I would encourage you, I think it's about 12 minutes. I would encourage you to take the 12 minutes to watch it and see. We offer this link to a lot of patients in our practice that are looking for solutions and answers for their kiddos. And so sometimes parents watch this and they really relate to Connor Deegan. It's a very emotional video. And we're really excited to be able to say that Connor Deegan, who is a struggling kid in the beginning of the video and just can't really find his way, and his mom is looking for every solution possible, really happy to report that Connor Deegan was treated with some of the Healthy Start appliances, and I will tell you it's a happy ending at the end of that video. But I would encourage you to watch that video and let us know what you think. Share it on our Facebook wall. So thank you so much for joining us tonight. I hope I was able to teach something to you. I hope that you can watch your children and evaluate what they're doing. And I'd love to pass it back to Kathy now so that she can close up the night. And Kathy, what'd you think? Did you learn anything new tonight?
No, can you hear me first of all?
I can hear you, yes.
Okay, so this is what I want you to know, that I'm just as excited when I hear it tonight as I am every time. And it takes me back, because I just want to chat with you for a few minutes to kind of maybe unveil a few of the questions that came up during the time that we were watching. And I think that a lot of parents are like me. You hear it the first time, and there's so many aha moments, the connecting the dots that, oh my gosh, who would have thought? Yet it just is so logical, so linear. And while we're watching you, we're reaching so many people, like 982 people on Facebook are reached. And of course, they'll be able to watch this over and over again. But it takes me back to when I first learned about this. And I have a grandson who, well, it's like you were talking about at 8 or 9 years old, how much of your personality it happens with the socialization in school. And his upper teeth were behind his lower teeth and the canine sticking out, and he hadn't openly smiled in years. So when I heard about this, I called my daughter and I said, oh my gosh, you've got to look at this. She called me back and she said, Mom, my dentist has never heard about this. And I said, okay. All right, this is what you got to know. And she came back a week later and she said, you know what, the orthodontist has never heard about this. They've never heard of your company. And of course, by the way, we want to remind everybody that this was all invented by an orthodontist. Right. But I said, hold on. So I privately sent her 13 minutes of video of a person doing a presentation like you just did, Jill. And she called me 15 minutes later and she said, Mom, you got to get this on Facebook. Yeah. So there you have it. So now here's my question for you, Jill. When you talk about growth and development, most parents would think growth and development, you're talking about their pediatrician. And yeah, their pediatrician is probably referring to you, but can you again tell parents why it is that the dentist or orthodontist is the absolute ideal caregiver to address this problem that we call the silent epidemic coming from sleep disordered breathing?
Yeah, absolutely. Great question, Kathy. I'm so glad you asked that. You know, the reason why the dentist, we know it's a medical issue. We know ADD, ADHD is a medical diagnosis. We know a lot of this is a medical issue, but great news is it has a dental solution. We as dentists have we're the specialist of the mouth and the head and neck and the growth and development of that. So dentists can absolutely recognize these outward signs and symptoms and work with the pediatrician. I work with several pediatricians and ENTs, and I the same issue that your daughter had, I knew about Healthy Start, and I wanted the whole world to know about it, and they didn't. So bringing that to them was really important, and then co-treating with that. So I would encourage if parents out there, if your dentist doesn't know about it, I have a lot of friends all over the country. Well, not like, oh, I'm so popular, but you know, I know people just in my life, I've met people over, so I can't help everybody. So I love that Healthy Start has a doctor locator that you can go on the Healthy Start website and you can type in your zip code and you can find the closest doctor to you. And I think that's really helpful. You know, the other thing I love about Healthy Start is, Kathy, I don't know if I told you this story, but I have a patient moving to Madrid. 3-year-old little kid who needs Healthy Start and desperately, and they're moving to Madrid. And I did the doctor locator and they don't have it in Madrid. I called the Healthy Start office and someone was so friendly, picked up the phone immediately. I said, I have this great patient moving to Madrid. Do you have anybody? They were able to connect me with 2 premier providers in Madrid that I could refer this patient to so that she could get care. It's one of the most cooperative, helpful companies I've ever worked with.
Well, you know, that reminds me of the fact that because you have had so much experience, you are a 4th-generation dentist. And as such, your father was one of the earlier adopters of this whole program. So he's a dentist, Dr. Michael Rossellini, that is actually in your practice now. The 2 of you work together, which is a great family business. But my question is, tell me, what kind of adult patients did he develop? Could you describe what those patients evolved into as dental patients?
I will. You know, not to bore you too much with my personal life story, but I started a practice from scratch about 9 years ago. And when I did that, my father has a separate location. We practice together, but he has a separate location. I said, you know, Dad, refer me some patients. Help me get started here. Come on. So he starts referring me patients. I see these patients. They have healthy jaw joints. They sleep well. They don't grind their teeth. They don't need Invisalign. Their teeth are all aligned. They have healthy gums because it's easier to brush and floss their teeth. You know, great healthy referrals. But I'm like, you know, Dad, they just don't need anything. I don't know if I can build a practice of these just very healthy people. But, you know, it was amazing because that's ultimately the goal, right, is to have a practice full of healthy, happy patients. I started seeing other patients, you know, new patients that came in, and they have jaw issues. They have popping and they have clicking. They're breaking all of this very expensive dentistry they've invested at other dentists because they grind their teeth at night. They're snoring. They're sleeping on couches because their wives boot them out of bed because they snore all night. They're absolutely exhausted. They're 40 years old and they look like they're 60 years old. They have heavy bags under their eyes. So comparing these two populations of patients just drove my passion. I said, you know, Dad, what are you doing here? What did you do for these patients? By this time, those patients that he's referred to me, they also have children and they're demanding the same level of care and treatment that he provided. So it really gave me this absolutely amazing, you know, crystal ball to look at these patients that were treated 30 and 35 years ago with these appliances and see how they are now. They're healthy, they're sleeping well, they have beautiful smiles, and now help their children. It's been a really fun kind of circle to be a part of.
Okay, one of the stories, because I know your stories, and one of them that I think is such a great illustration for other parents to think about, because we do what we think is the right thing to do, and sometimes we are going to take the advice of people who say the same thing because that's all they know. And so if you could tell the story about the lady who was a single mom, who worked 2 jobs to pay for it, but she, on her watch, wanted the right thing for her son, put him in braces. And
yeah.
You tell the story of what happened when they celebrated the braces coming off.
Yes, she had her braces taken off, and she was just one of the most incredible mothers ever. She worked 2 jobs to make the investment in her son's teeth, and it was this big day. The orthodontist referred her son over as a new patient, so I saw him for the first day, the first time. So excited. He has his braces off, this big white smile. We took we did an exam and took x-rays as we do on every new patient. And I was absolutely heartbroken to diagnose 32 cavities. So, congratulations, your son has beautiful straight teeth, absolutely full of disease and cavities. And, we had to almost pick her up off the floor. She was devastated because here she thought she was doing the best thing for her child. And you know what? He wasn't even the stereotypical teenage boy. He was clean cut. His hair was always brushed. That was the big Justin Bieber face. So his hair was always Justin Bieberized, just right. And, he was a great kid, and still 32 cavities. I mean, it still haunts me to this day. And if only if only his mother knew of a different option, of a removable appliance that's worn at night only, it would have been a different outcome for that kid. Not to mention, and that's just from a health perspective, let's talk about it from a financial perspective, Kathy. HealthyStart typically is half the fee of traditional braces. So here's this mother who broke her neck working 2 jobs to make this investment for her son, only to find all these cavities, when really this other option was out there. I wish I had met her before, because here's this other option that's going to be better for his oral hygiene. And hey, by the way, it's half the fee of traditional braces, and the ortho insurance, dental insurance, also covers this. So your insurance can help with it too. I mean, I could go on about this family forever. They're still patients, and they're fabulous, and he's doing wonderfully, but gosh, his story could have been so different.
I'm going to take now to the broadest picture that I can as a parent and a grandparent before we close out for tonight, and talk about, what any parent typically will do. We always want better for our kids, to give them any minor edge, to give them every advantage, to be the best they could be. So when you consider whether it's additional education and tutoring and the right sports and organizations and learning music and all of these things that we could do for our children. The advantage that you give a child when you give them Healthy Start and they have oxygen, when they have all of these things in the right balance, how do you evaluate and measure that advantage versus anything else they could possibly spend a dime or a minute on?
Well, Kathy, you know my answer to this question. I mean, I feel so strongly, kids are absolutely incredible. And if we can help a child become the best version of themselves, stand back and see what they do. You know, we see, we have one little boy who's just absolutely awesome. He was a great kid, but we got him a good night's sleep and it became even better. You know, he was a soccer stud, scoring 2 and 3 goals a game, and now he sleeps better, he has more energy, runs faster. He averages 12, 13 goals a game. I mean, it's incredible. Now, that happens to be 4-year-old soccer, and it's my son Gino, but still, that's incredible. You know, he is dominating out there, and he knows he has to wear his appointment the night before. But, you know, I really think, what advantages can we give our kids? What tutoring, what after-school programs, what the best private schools, the best this, the best that. Hey, I get it. I'm a parent, and I'm always looking as well. But I think the gift that I'm giving my children is the gift of a good night's sleep so that they can be the best version of themselves and unlock their potential. And then I get out of their way and I just let them soar from there. And I think that's the best gift as parents that we can give our children.
Jill, what we've just done is the tip of the iceberg tonight. And we invite people, of course, every Tuesday night to come and ask other moms, other friends, other moms and dads to find out, because the conversation could go on and on. But let's start with the very first thing that a patient and parent might want to do, and that's take this sleep questionnaire, which you see on the screen right now. You can take that on our website. Of course, if you've got questions, you can call the office, 844-KID-HEALTHY, but the HealthyStart.com, and of course, the Learning Center is HealthyStartChild.com. And as clear as we can make it, we want you to realize that all of this benefit for your child is kind of tied to their growth chart. You've got to get there before adolescence, which is why we say, don't wait. Don't wait. Don't wait to share this message with others. Come back next Tuesday. And a very special thanks to our wonderful Dr. Jill Ombrello of Central Dentist in Dallas, Texas. Great job, as always. You're going to be in Houston on April 21st and 22nd, back to the alma mater, and a lot of the other dental students will be joining us and learning a little bit more. You're going to help certify them to be the next leg of the journey for our community here. Thanks, Jill.
Thank you, Kathy. Have a great night. Thank you, everyone.
Good night, all.